Welcome to Spinal Chat, a podcast of the Pennsylvania Chiropractic Association. Today's episode features the January President's Address, originally published in the PCA newsletter and shared here as a special audio edition for our members and the broader chiropractic community. This address reflects where chiropractic stands in Pennsylvania at the start of the year and where we are headed next. It speaks to real momentum in legislation, momentum in advocacy, momentum in how chiropractic is positioned within the broader healthcare system. From scope modernization and insurance reform to workforce stability and patient access, the work being done today will shape the profession for years to come. As you listen, consider this question. If chiropractic is proven, effective, and essential to conservative care, what role will you play in protecting and advancing it? Here is Andrew Hecht, the President of the Pennsylvania Chiropractic Association.
Hey everyone! As we begin a new year, I want to take a moment to share how excited I am about the momentum we are building for chiropractic in Pennsylvania. This year holds tremendous potential for our profession, and the progress we are making together is real, measurable, and meaningful. At our core, we know something to be true. Chiropractors are among the most effective first-line providers for neuromusculoskeletal conditions. Our patients have known this for decades. They experience it every day in our offices, and now the research is finally caught up with what clinical outcomes and patient experience have constantly been showing. So that begs an important question. If chiropractic works so well, why does utilization still hover around just 10 to 15% annually? The answer lies largely in history. For years, the chiropractic profession was actively disparaged by the American Medical Association, influencing generations of public perception. That legacy still lingers today, not because chiropractic lacks value, but because misinformation has been slow to unwind. This is precisely why the work of the Pennsylvania Chiropractic Association matters so much. Our role is to change perception, educate the public, and advocate for the value and validity of chiropractic care that has always been present. We are also becoming more confident and more intentional in how we define our role within a broader healthcare system. Chiropractors are trained as first-line providers. We perform clinical diagnoses, order imaging when necessary, and manage patient care autonomously. Think about this for a moment. In what other circumstance can a patient with back pain receive a comprehensive evaluation and meaningful relief in the very same visit without delay, referral barriers, or fragmentation of care? That is not just convenient, that is valuable healthcare. With that in mind, I want to introduce a concept that will be increasingly important moving forward. The term chiropractic physician. This term has meaning. It accurately reflects our education, training, and scope, and it elevates the profession to the level of respect it deserves. We are not a therapist-level profession. Our role in healthcare is far more comparable to that of a podiatrist or an optometrist than a physical therapist, given our doctoral education and clinical autonomy. This distinction matters, especially as we communicate with legislators and insurance companies. Clear language leads to clear understanding, and clear understanding leads to better policy, better coverage, and better integration within the healthcare system. On the legislative front, we continue to make strong progress. House Bill 1106 is advancing well and is focused on restoring the delegation of therapeutic exercise, an issue that directly affects patient care and practice efficiency. We have also secured a Senate companion bill with Senator Bartolotta as prime sponsor, who is a strong supporter of chiropractic. We recently met with Chairman Burns, and I'm encouraged by where this legislation sits. I'm hearing that we have a very real opportunity to move House Bill 1106 out of committee in the near future. But let me be clear, when you do exceptional work with your patients, it makes my job infinitely easier when advocating for chiropractic in Harrisburg. The stories, outcomes, and professionalism you demonstrate every day matter, and legislators notice, especially if they are your patients. We are also working diligently on your insurance issues. We've had recent meetings with Highmark and UPMC, and we continue to address concerns related to prior authorizations, reimbursement, and administrative barriers. Please continue to report issues through the PCA insurance portal. This data is critical. Because of your reporting, We were able to have a productive and informed conversation with Highmark regarding recent prior authorization glitches and systemic challenges. Finally, I want to share one more exciting development. The PCA now has a public-facing podcast, Spinal Chat with the PCA. This is another tool to help educate both our members and the public on chiropractic care, policy, and the role we play in modern healthcare. Thank you for the work that you do every day, for your patients, for our profession, and for the future of chiropractic in Pennsylvania. Together, we are changing perception, strengthening our voice, and positioning chiropractic exactly where it belongs. Here's to a strong and impactful year ahead.
Thank you for listening to the January President's Address, originally published in the PCA newsletter. The progress you just heard about does not happen by accident. It happens because chiropractors show up, they engage, they support advocacy, and they invest in the future of their profession. If you believe in protecting patient access, strengthening chiropractic's role in healthcare, and ensuring our voice is heard in Harrisburg, there are two simple ways to get involved. First, consider joining or renewing your membership with the Pennsylvania Chiropractic Association. Membership provides the structure, credibility, and collective strength needed to move policy forward. Second, consider supporting the PCA PAC. Advocacy requires resources. Even modest monthly support helps fund the relationships and efforts that advance legislation like House Bill 1106, scope modernization, and insurance reform. And if you want to take the next step, volunteer. Reach out to the PCA advocacy team. Whether it's attending Advocacy Day, making calls, or sharing your story, your voice matters more than you may realize. Chiropractic is strongest when we stand together. We'll see you next time on Spinal Chat.